Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about one of my favorite exercises to give to patients when their lower back is starting to tighten up with prolonged sitting or with not essentially moving for long periods of time. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, when people are sitting for long periods of time, what can happen is when we have essentially no mobility in through the back, it can start to get sensitive, it can start to get tight, and people can experience some discomfort, some pain in through that area. So the patient the patient I would typically give this particular exercise to would be somebody who has central lower back discomfort or pain. Their symptoms aren't peripheralizing, and what I mean by that is they don't have symptoms going down their legs or anything of that nature. So they're not experiencing perhaps symptoms of like sciatica or anything of that nature. And a lot of times too, this type of patient might be sitting for a long period of time, right? So office workers, they might be at home and they're kind of in this, prolonged, let's say, slouch type position. And so a great little exercise to give these type of patients is repeated pelvic mobility, so anterior and posterior pelvic tilts essentially in sitting to essentially get some movement right through the lumbar spine. So in a lot of cases, right, if somebody doesn't have the opportunity to get up and move, right, to walk around, which is another beneficial sort of exercise for somebody to do, again, with prolonged sitting, to walk around. But again, if they don't have that opportunity, I really like this pelvic tilt type exercise. So essentially, I'm going to show from the side here, but what it involves is essentially moving from an anterior and then a posterior position in through the pelvis, just back and forth like this, right? And in particular, we might want to emphasize the extension position, so this right here, right, where we're going into more of an upright position. And again, I'll just have the patient go back and forth, and what this does is it helps to desensitize, right, the lumbar spine, and it can help in terms of just improving mobility, lubricating essentially the joint in through the lower back area, and really helping to get some circulation and some blood flow into that area, which again can help to desensitize the lower back and help with pain. And so essentially I'll have a patient just perform this particular exercise throughout the day as needed with sitting, and then ideally combine that with some form of walking if possible. It might just look like 5 minutes getting up, walking in the hallway of their house if possible. If you have any questions or concerns, feel free to leave a comment below, and please make sure to check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.